I love working at Swanage Hospital because it's a part of my community, it's where I live, and it's an absolute honour to be able to look after the patients of my community.
Swanage Hospital is a wonderful place to work. It's such a friendly place. Everybody talks to everybody. We have a laugh, we get the work done, but it's just a great place to work. I'd like to stay here for many years.
Coming out of the fast pace of life to a slightly different area, lovely area to live in, and not a bad area to work in.
It's a very friendly hospital. It's like a family. We all work in a team.
Swanage Community Hospital is a 124-year-old building and it's quite deceptive what's actually going on in the hospital. We have a day surgery, endoscopy unit, we have minor injuries, which is open 7 days a week. We also have X-ray, ultrasound. We have a 15-bedded inpatient unit, Stanley Purser ward, which is a nurse-led unit. Then we also have outpatients physiotherapy, outpatients podiatry, and our outpatients department, which covers a range of clinics from ophthalmology through to urology and gynae.
I think of it as being a mini general hospital. It has the same dynamics as a general hospital and it offers such a huge range of care and different departments. We offer a wide range of clinics here in outpatients. We have about 15 clinics where consultants come from Dorchester, Bournemouth and Poole Hospital. We also have nurse practitioners and other professionals that come and hold their clinics here.
Been matron here at Swanage for about 4.5 years, and I came here from a very long career within the acute setting. And it was a really steep learning curve coming to the community because I imagined it would be quite sleepy, quite quiet. It isn't. There is so much going on, from our complex discharges to our challenges with patients who have a multifactorial problem. So there is always something to learn.
Living here for about 8 years, we moved from London. I had a small boy at the time and wanted somewhere nicer to live. So the job came up here and applied, and it's a wonderful place to live and I don't regret one bit.
It's a beautiful outdoorsy area, probably the best commute in the world. From where I live, about 20 minutes away. I only have to stop occasionally for the dairy herd or the tractors. And we've got the beaches, the countryside, huge variety of lovely outdoor space. And Swanage is set overlooking Swanage Bay.
As soon as you come out of work, you're taken to a beautiful place. So I just love it. And so do all the family. We go out canoeing, we go out running, cycling, and just really enjoy the area as well as enjoying working here.
So I think it's amazing living by the beach. I always wanted to live by the seaside, so I think this is the most great thing that I've ever done.
I quite like everyone works as a team throughout the hospital, so within you've got the day surgery unit, physiotherapy, the ward, outpatients and us and the radiographers, and we all work as a team and we'll help each other out. It's a real team spirit within the hospital.
We all enjoy mixing, getting together. The hospital's got a really good family feel. Truth of that is once a month we get together and have a Swanage Hospital breakfast. All of the teams get together, sit down, have a chat, breakfast, coffee, and it's just a nice way of rewarding staff, getting together and just creating that family feel. There are a lot of opportunities to develop, whether you're a newly qualified staff nurse coming in to work on the hospital. The ward offers, and the other departments offer, a huge amount of support for our newly qualified staff coming in. One thing I found is it's a really good place to get the grounding for building your confidence, building those skills that you need to get you on to the next stage of your career pathway.
The good thing with Dorset Healthcare is that there's loads of training opportunities, loads of different ways of developing your knowledge and skills. There's lots of different pathways that you can follow. So my aspiration of when I first qualified, I'd always wanted to be a ward sister. I wanted to say this is my ward and something that I was really proud of. So it was great to have the opportunity of starting here as a staff nurse.
I've developed my skills into palliative care, leadership skills, and I'm now able to lead the team as a senior member of staff.
I worked my way up through the ranks and had the opportunity of becoming an acting ward sister. Within, I think it was 12 months, an opportunity came for the senior sister post. So very quickly I went from a staff nurse to a ward manager.
Yeah, the local people love this hospital, and the League of Friends and people raise a lot of money for things within the hospital. So the people of Swanage have a lot of good feeling towards the place.
The Friends have been supporting Swanage Hospital for donkey's years now, and they do it by all sorts of different ways. We have events throughout the year where we raise money. We have hundreds and hundreds of members who pay a subscription. We have amazing donations and some extraordinary legacies recently, which have enabled us to do a lot of work in the hospital. The value is immense to the town. They want their hospital to be as best as it can be, and so we'll support it wherever and whenever they can.
We have achieved accreditation within our endoscopy unit, and we were the first community hospital to achieve that. On the Stanley Purse Award, we have gold standard framework accreditation for end-of-life care, and that's another aspect of care that we are especially proud of. We talk about personal care. Within the community hospital setting, we can give that level of care, from sorting out a complex discharge to sitting with and spending time with someone in the last moments of their life. And that is one of the huge, great privileges that we experience on a regular basis.
So it's a very special place, so until you actually start working here you don't appreciate that Swanage is the heart of the community, and it's an absolute honour to be a part of that. That's why I love it.